Good morning. Welcome to our 15th annual Hill Day. What a joy to look out and see this crowd of people coming to Washington because you want to make a difference. Hill Day is an important milestone for the National Council and for the field. This is when we come together to advocate for change here in Washington. Now, do we want little change? We want systematic change, right? We want exponential change. We want change that can make a difference in the lives of people. And I think all of you know that Hill Day is a special day for me. For my entire career, I've been driven by the idea that public policy is an important route to improving care for people living with mental illness and addiction, people cut off from society who are vulnerable, who suffer from trauma, from addiction. I want to make a difference in people's lives, and I know that all of you want to do the same. And we know that for too long, our country has underfunded and undervalued mental health and substance use prevention, treatment, and recovery services with devastating results. Only 12% of people who have a substance use disorder have access to specialty treatment in any given year. And only 43% of people living with mental illness have access to treatment. 1 in 4 Americans reported having to choose between getting mental health treatment and paying for daily necessities in a poll that was recently done by the Cohen Veterans Network and the National Council. But in the midst of these terrible numbers, there are signs of progress, and I think you see this every day in your communities. More and more people are coming forward to access treatment. I think this is driven by the realization that more people in this country have that prevention works, treatment is effective, and recovery is possible. That's the good news. Unfortunately, lack of access to timely, high-quality care has replaced stigma as the most significant barrier to a healthier America. Just as more people are seeking treatment, too many of them are encountering unnecessary obstacles to receiving care, long waiting periods driven in part by a nationwide shortage of qualified behavioral health workers. Behavioral health care professionals can only meet 26% of the need for services in this country. And despite the passage of parity law, too many people are still being denied treatment. Everyone in this room is here because you want to fix these problems. We are all here for the same reason. We want to build a nation that recognizes the essential truth. Without mental health, there is no health. We know that recovery from mental health and substance use conditions should be the expectation, not the exception. So today I'm excited to launch a new initiative from the National Council. Today we are unveiling the Unite for Behavioral Health campaign. This new initiative will leverage the National Council's track record of success, along with the passion and expertise of all of you, to lead the nation towards a future that values the whole health of every American. The Unite for Behavioral Health campaign seeks to achieve 5 essential objectives and that represent the greatest opportunity to improve the health and well-being of the nation. First, we want to fundamentally change the model when it comes to the delivery of behavioral health care. Quite simply, second-class status for behavioral health is unacceptable. As you know, hundreds of organizations around the country have become certified community behavioral health clinics and are leading a bold shift to integrate physical, mental health, and substance use treatment to address social determinants of health, provide 24/7 crisis care, collaborate with law enforcement and their local schools, and coordinate with hospitals to reduce emergency room department visits and readmissions. This is the model for the future, and we are committed to bringing CCBHCs to every state. Second, we have to accelerate our nation's response to unhealthy substance use. More than 20 million Americans are living with a drug or alcohol addiction, and drug overdose deaths from opioids and other drugs have more than tripled since 1990, and we all know that this is unacceptable. The National Council is fighting to build capacity in our delivery system to ensure that everyone who seeks treatment is able to receive it. This includes removing barriers to medication-assisted treatment and advocating for sufficient funding to address the addiction crisis nationwide. Third, we will redouble our efforts to strengthen the field and expand workforce development programs. As you well know, there simply aren't enough behavioral health care professionals to meet the need for services, and the deficit is significantly greater in rural areas. And this problem will only get worse without targeted interventions. We will work with policymakers to incentivize more people to pursue careers in the addiction and mental health field through enhanced reimbursement policies that actually enable clinics to pay competitive wages, through the expansion of Medicare reimbursements for counselors and marriage and family therapists, by expanding loan repayment programs, and more. Fourth, we know our work on parity is far from done. More than 10 years after the passage of the Mental Health Parity and Addiction Equity Act, people are still being denied access to mental health and addiction treatment. We are working to ensure full implementation of parity in all 50 states. And where the law is not sufficient, we will work with advocates to change federal and state laws. Finally, we have to get more people trained in mental health first aid. We know that anyone, anywhere, can make a difference and potentially save a life. More than 2 million people have already been trained, and we will continue to grow that number. To that end, we will advocate for additional funding at the federal and state level to ensure training is available to police officers, teachers, and other critical community people. I am incredibly excited about this campaign and about the potential that we have together to make a real and lasting difference. And I am emboldened knowing that the majority of Americans share our vision and our commitment. Today, the National Council is releasing new public opinion research that shows that 77% of Americans believe the country and the federal government are not doing enough to address mental health. And while so many issues of our time are shaped by partisan divisions, there is clear and strong bipartisan consensus on this one. 85% of Democrats and 68% of Republicans believe the federal government is not doing enough to address mental health. When it comes to addictions, 79% of Democrats and 60% of Republicans agree the federal government is not doing enough. And here's what elected officials need to know as we head into 2020. Americans want them to stand up for mental health and addiction treatment. 75% of Democrats and 52% of Republicans say they would be more likely to vote for a candidate in 2020 who promised to do more to address mental health and addiction. I think those numbers speak for themselves. Our mandate is clear, and our obligation is to turn this bipartisan consensus into meaningful policy changes. So, that's where all of you come in. That's why our work over the next 2 days is so important. I want to extend a special thanks to our national advocacy partners. This year, we are proud to be joined by 26 other national organizations in sponsoring Hill Day this year, and also a special thanks to our corporate supporters for making Hill Day possible. Many of you have been with us from the very first Hill Day when there were only 70 of us. My, how things have changed. And we know that this gathering keeps getting better every year. Everyone in this room, you are the most effective advocates for solutions for increasing the federal investment in mental health and substance use treatment. Every one of you can talk not only about the struggles you face every day, but also about the incredible progress you are making in your communities. Each and every one of you is making a difference in people's lives today. And we know that the American people want us to be able to do more, to serve more people, to help more people get better, to make recovery possible. As our Hill Day slogan says, our voices are louder together. So over the next 2 days, let's get out there, let's get to work, let's make a difference, and let's make some noise for behavioral health.